cigarettes, cigars, other tobacco products are bad for your health. You know that. But what if you smoke electronic or herbal cigarettes?
With us now is Dr. Bill Bowerfind. He's a pulmonary specialist with Providence Health Services. Dr. Bowerfind, fill us in on these electronic cigarettes. How do they work and what's their purpose?
Yeah, good morning. Thanks for having me. So electronic cigarettes, basically these are known as e-cigarettes or personal vaporizers, and they are devices that are about the size and shape of a cigarette. They have the outward appearance of a cigarette to a casual observer, and they vaporize liquid that contains nicotine and also other additives like water, certain flavorings, and propylene glycol into an aerosol mist, and it really sort of simulates the act of smoking an actual cigarette. And these things have batteries in them that in addition to powering the vaporizer, also often power a little LED light at the end of them that gives them the appearance of the ash of a cigarette being smoked.
I think candy cigarettes were more fun than that.
Well, these produce a vapor, an exhaled vapor, in addition, that really is, it's hard to know exactly what's in it because these are not FDA regulated, and that's really one of the problems with them, is that we don't have good details about exactly what chemicals are in them. And there were some tests done back in 2009 by the FDA on a couple of these cartridges from about 20 different cartridges from different e-cigarettes, and a couple of them were found to have some low levels of carcinogens in them at that time. And really one of the big problems is the lack of some sort of oversight to determine exactly what's in these and what we're being exposed to when we use them.
Yeah, let's talk about herbal cigarettes. There's no nicotine in them, but is the smoke from those still dangerous to your body?
Yeah, so that brings up an important point. And one of the common misperceptions about cigarettes is that nicotine is the cause of cancer or the cause of lung disease or heart disease. And nicotine is not the thing that causes cancer. So the fact that they don't have nicotine really doesn't reduce the health risk very much. Nicotine really only causes a transient increase in blood pressure or pulse. It is not the thing that's associated with the major health risks of cigarettes. So we know that, for example, with herbal cigarettes, that when you burn any sort of vegetable matter, any sort of tobacco that is, or herbal cigarettes, that the burned product produces tar, carbon monoxide, and most of the other toxins that are produced by cigarettes. So when you breathe in the smoke of an herbal cigarette, you're breathing in those harmful toxins directly into your lungs.
Dr. Bowerfind, thank you for joining us.
Yeah, absolutely. My pleasure.
Dr. Bill Bowerfind, a pulmonary specialist with Providence Health Services.